Hello and welcome. DJ here again. Thank you for visiting my channel. I'm always appreciative of you when you arrive at my channel and you stay with me. And if you subscribe, I'm even more appreciative. So don't forget, doesn't cost you a penny, doesn't cost you a cent, doesn't even cost you a rupee to subscribe. It's totally free. So why not just press that subscribe button, and it enables me to continue doing this research and telling you all about it, because the national press often will not tell you. So please listen to this, and I've got to say this. I'm worried about the figures that are coming out at the moment on what are we doing with our health service. But has our woke policies and ideals within our health security agencies put our health at risk? Now, why I say this is because there's a massive increase in HIV diagnosis across Britain, across England. In 2023, there were just over 6,400 HIV diagnoses. 6,400. And that was in the UK, a 46% increase compared with the previous year, 2022. 46% increase. Health officials have said the wave of new cases could be a sign of ongoing transmission. Well, of course it is. Or a reflection of the migration or the immigration bringing more people with HIV into the country. This makes me wonder, from which country are these potentially at-risk people coming in from and bringing in this viral disease, and why are they not undergoing medical tests before being allowed to mingle with our population? Woke policies. That's what I say. Has woke policies and ideals within our health security agency put our health at risk? Well, new HIV diagnoses soared by 30% in heterosexual people, not homosexuals, heterosexual people. 30% increase in just 1 year. In that 1 year, more than triple the rise seen in those of the LGBTQ whatever community. More than triple. It was about, in the LGBT, it was about 8%. But in the heterosexuals, 30% rise. But don't worry too much. I'll let you know why in a bit. Newly published data shows the majority of new cases involved patients of ethnic minority groups. I took this from a report that I was reading, and I thought, yes, ethnic minority groups, but you're not going to name them, but I'm going to. In total, the number of new HIV diagnoses discovered through testing in England increased by 15% from 2,450 in 2022 to just over 2,800 in 2023. Charity said the rise in cases left the government's goal to end new HIV transmissions in England by 2030 in jeopardy. Well, why? Because of immigration. It said above, the official said it could be from a reflection of the migration into this country. And so why would it affect? Because they're not stopping the immigration and they're not testing them for AIDS. It makes sense, doesn't it? But it doesn't make sense on the behalf of the people safeguarding our health. So, as I say, heterosexual men had the biggest increase in new HIV diagnoses over the last year, with 600 cases in 2023, a rise of 36% in the heterosexual body of men. Women having sex with men saw a small but insignificant rise with nearly 800 new cases, a rise of 30% from the previous year. That is not as it says, it's not an insignificant rise. It's a significant rise. 800 new cases of women, a 30% rise from what it was before, the year before. Getting HIV from men. UK Security Agency, which goes under UK HSA, said it was unclear what was driving the spike. It was unclear to the agency that the Security Agency for Our Health. It was unclear to them. Why is it unclear? If they checked by place of birth, only 902 people, about a sixth of the total HIV cases recorded in 2023, were born in Britain. 902 cases. They were born in Britain. So over half the cases recorded in 2023, some 3,300, now get this, so there's 900 people who were born here have got HIV, picked up HIV in 2003. In the same year, some 3,300 were people originally born in Africa. 3,300 cases of HIV were among the people originally born in Africa. But the Health Security Agency is unclear what is driving the spike in most cases. Immigration! Whoa! However, experts have suggested people opting out of virus blood testing in A&Es, accident and emergency wards, clinics, failing to report previous diagnosis as well as underlying transmission could be at play. They will keep playing it down. The majority of cases were for people from Africa. But they say, it's because people opted out of blood testing. They failed to turn up. Underlying cases, reasons. No. Look at the figures. Look at the facts. Increasing HIV diagnosis was particularly high for heterosexual people living outside of London. New cases of HIV in men rose 51% outside the capital last year, with 44% increase in women compared to 2022. So last year, I'm talking figures 2023, 2022-2023. While London itself, new cases in men only rose 9%. So 44% of these cases of HIV diagnosed in 2023 was this 45% increase, but it only increased in men having sex with men 7% to just over 800. So let me get this straight. I want to get this straight for you. The rise, new cases of men was 51% outside the capital, right? While London itself, new cases rose by 9% and actually decreased for women by 2%. The rise was highest for non-white ethnic groups, with a number of diagnoses increasing 45% compared with the previous year. In contrast to heterosexuals, HIV diagnosis in men who had sex with men rose 7% to just over 800. Officials said they were working to further explore the reasons for this rise in new diagnoses. Look at the figures. Most of them came from Africa. But added, it could include the opting-out testing in emergency departments, clinics not reporting some diagnoses which had been previously diagnosed abroad, or ongoing underlying transmission. I'll cover this on a broad bit. previously diagnosed abroad in a moment. The figures also show that 40% of people whose HIV was first diagnosed in England in 2023 were diagnosed at a late stage where the disease had already started to damage their immune system. This data only relates to cases where HIV was first diagnosed in England. When people already had HIV previously diagnosed elsewhere in the world, when they were included in the total new cases recorded in the country last year, it rose by 6,008. Now that source is from the UK HSA, the United Kingdom Health Security Agency itself. So I'll read that again. When people who already had HIV previously diagnosed elsewhere in the world were included in the total new cases recorded in England, in this country last year, it rose by 6,008 people. So we allowed in to our country 6,008 people in 1 year, in 2023, who were HIV positive. We allowed them in. I mean, I'm not making these figures up. These figures are supplied by the UK HSA, the United Kingdom Health Security Agency. I mean, this means that over half, 53% of all HIV diagnosed in England in 2023 were among people previously diagnosed before they entered the country. Now, in 2022, 4,000 diagnosed outside the country came in to the country. 4,000 had HIV, so 6,008 to 23, 4,000 in 22. There's 10,000 straight away in 2 years. I mean, the mind boggles, doesn't it? It does. By place of birth, only 902, about a sixth of the total HIV cases in 2023, were born in Britain. Over half the cases recorded in 2023, some 3,300, were among people originally born in Africa. Total cases also covered all potential routes of HIV transmission, which, in addition to sex, also from contaminated needles, in drug use, and where babies catch the virus from their mothers, because it's transferred through mother's milk. While the number of tests for HIV carried in England increased in 2020 by 8% compared with the previous year to 1,300,000, levels still only at 96% of that carried out in 2019 before COVID seriously hamstrung. I just added that it wasn't worth mentioning, so I sort of brushed over it. The United Kingdom Health and Safety Executive said the overall rise in cases could suggest ongoing transmission, but added figures could be affected by migration. Well, if you've got 900 and you've got 6,000, I think, and 6,000 are from migration, then their stupid comment, figures could affect migration, bringing diagnosis abroad into England, it's such an understatement. It's ridiculous. Overall, there were 93,099 people living with diagnosed HIV in England, but almost all, 98%, were virally suppressed, meaning they're unable to pass the virus on to others thanks to medication. That's if they're taking it, of course. If you see, again, they said 98%, but what did they say earlier? That those born in Britain, they arrived and found out there was HIV affected once their immune system was already being attacked. Therefore, they had plenty of time to pass the disease on before they got the treatment. You have to read between the lines with these people, don't you? They're saying, oh, it's okay. They can't pass it on. But they have. Commenting on the figures, Robert Curry, Chief Executive of the National AIDS Trust, said the latest published HIV data in England shows clearly that there's a continuing lack of equity and equality in standing in the way of people being able to live well with HIV, and puts the goal of ending new cases of HIV in this country at risk. He's put it down to equity and equality. No. It's having homosexual sex. It's having, and then passing it on to your wives and your girlfriends. It's not about equity and equality at all. I feel I've got equity and equality. I'm not going to be passing on HIV or AIDS because I haven't got it, because I don't engage in those sort of practices. The UK government must respond in full to the worsening disparities and trends that we see in this data with a strategic funding action. Give us money to help these people who engaged in homosexual sex. Sexual Health Charity Terence Higgins Trust said the goal of ending new cases by 2030 is in jeopardy. Chief Executive Richard Angel said today's new figures show people from ethnic minorities face an increasing burden of HIV with rising diagnoses and worse health outcomes than the population as a whole. Perhaps they should curb their sexual tendencies and their cheating and adultery. Recent strong progress among gay, bisexual and other men who have sex with men seems to have stalled. Well, what sort of progress was he looking for? I'll repeat what he said. Recent strong progress among gay, bisexual and other men who have sex with men seems to have stalled. My mind boggles what he means by strong progress among them. Today's figures are a call for action. We need innovation and new resources to address these health inequalities and reach the 2030 goal. Time is of the essence. Yes, we do need action. The action is wear a condom or don't do it in the first place, and stop infecting your wives and your girlfriends afterwards. Dr. Tamara Durek, I'll spell her name, DJURETCIC, co-head of HIV at the United Kingdom's Health and Safety Executive Agency, said it is clear that more action is needed to curb new HIV transmissions, particularly among heterosexuals and ethnic minority groups. I don't know where they keep getting this idea. We need to be taking action to save other people from what they're doing. Just stop it. We're paying fortunes out. Our taxes are going nowhere because they're paying for immigration, they're paying for hotels, they're paying for telephones, driving lessons, and now they're saying we're not paying enough to stop the homosexuals and spreading HIV, and it's amongst now the heterosexuals. How did it get there? Because men were having sex with men and then going back to their wives and their girlfriends. Why should I pay for that? Why should you pay for that? Addressing these wider inequalities, ramping up testing, improving access to pre-exposure prophylaxis, and getting people started on HIV treatment early will be all crucial in achieving this. HIV can affect anyone, no matter your gender or sexual orientation, so please get regularly tested and use condoms to protect you and your partner's health. it doesn't affect everyone. And it is a matter of sexual orientation. Now, it may be that a woman is infected because the man is bisexual. He has to curb his tendencies. I don't want to be paying for his philandering. I'm sure you don't either. An HIV test is free and provides access to HIV pre-exposure prophylaxis if needed. So you can have your test, and if you're found positive, we'll pay for your condoms. Why is the government coming to me and saying, listen, that man has picked up HIV, can you pay for his condoms? The answer is no, I don't want to. If you do test positive, treatment is so effective that you can expect to live a long, healthy life and you won't pass HIV to your partners. Well, if you've got HIV virus and you can't get rid of it, then how are they having a long, healthy life? They might live, but is that healthy with a virus inside you? The nonsense these people are speaking to pull the wool over our eyes. Now they admit HIV damages the cells in the immune system and weakens the body's ability to fight everyday infections and disease. The virus is spread through bodily fluids such as semen, vaginal fluids, blood and breast milk. I mentioned the breast milk with the feeding the babies and infecting the babies of an infected person. However, it cannot be spread through sweat, saliva or urine. It is most commonly transmitted through condomless anal or vaginal sex. Tests are the only way to detect HIV. They are available from your GP, sexual health clinics, some charities, and online involving taking a sample of the saliva or blood. Preventive HIV medication can be also subscribed to over 16s. It slashes the risk of contracting HIV if it is taken correctly. Those who take post-exposure prophylaxis and anti-HIV medicine within 72 hours of exposure may avoid becoming infected at all. So go ahead and do it, and we'll give you a pill, and you won't have to worry. For those who are infected, however, no cure is available for HIV. But antiviral therapy, which stops the virus replicating in the body, allowing the immune system to repair itself, enables most to live a healthy life. Levels of the virus in those taking antiviral therapy will drop so low that they can have condomless sex without passing HIV onto their partner, though this can take up to 6 months. So they're saying wear a condom and you won't get it, but if you've got it and we give you this pill, it will lower the effects of HIV and then you can have condomless sex. Doesn't make sense. AIDS, acquired immune deficiency syndrome, is the name used to describe an array of potentially life-threatening infections and illnesses that happen when your immune system has been severely damaged by HIV. Yes. However, those who are diagnosed with HIV early and begin treatment will not develop any age-related illnesses and will live a near normal lifespan. Public Health Minister Andrew Gwynn said, "This data shows we have much more work to do and brings to light concerning inequalities in access to tests and treatments." I'm puzzled on that one, his comment by the Public Health Minister Andrew Gwynn. It brings to light concerning inequalities in access to tests and treatments. What inequalities? People are allowed to get the test free of charge, so there's no cost involved. Therefore, there are no inequalities, and the people who are having the test are the ones who have been behaving in dangerous behaviour. I won't be going for those tests because I don't engage in dangerous behaviour. So I'm not in the way. So why is there inequalities? We've already seen that out of the 6,000 people who were diagnosed with HIV, 6,008, there was only 905 British-born people. Then the 6,008 were from abroad. So we're not stopping them having these tests. I think they should have the tests before they arrive, before they're allowed in, before they're allowed to integrate with the British public. But that's anti-woke. I must be far right. So Andrew Gwynn, the public health minister, says, I will be working across government to ensure that we work to stop HIV transmissions for good. Well, you won't be able to as long as you're allowing them in. Our new HIV action plan aims to end transmissions in England by 2030 with better prevention, testing and treatment. Now, the way to stop the transmissions is education. Telling the people if they engage in activities which are liable to bring them into contact with HIV, they've got to stop it. Be responsible for your own health. Be responsible for your own actions. That is the answer, not us taxpayers being made to pay for your mistakes. Comments, please. Please give us your comments. I know I've gone on for a while on this one. I think it's 27 minutes. But, I want your comments. Don't forget that subscribe button, and don't forget, it doesn't cost you a penny, doesn't cost you a cent, doesn't even cost you a rupee. It's totally free. So press that subscribe button, press the like button, and let's have your comments. Go on, let's have your comments. So until the next one, be safe, be good, and goodbye from me. Bye.